So this is my patient education PowerPoint. I'm just going to be explaining why it's so important to have your teeth cleaned regularly and why a good home care regimen is important as well. If we were at the clinic right now, I'd be doing a plaque score. So basically that means that I would just be painting like a disclosing solution on your teeth, and then your plaque would show up pink and your calculus would be purple. And so it's good for patient education because then it could show you where you're missing whenever you brush your teeth. Usually it's like the linguals of your like bottom teeth, and your molars. So the nature of plaque, plaque is always in your mouth. Even right after you brush, it starts forming again. So that's why it's so important to brush your teeth regularly. And plaque kind of is the reason for cavities and periodontal disease. And plaque hardens into calculus when it's not disturbed for a long time. So like I said, so when plaque is sitting there for a while and you're not brushing, that's the bacteria that's already in your mouth, and when you eat food that has a bunch of carbs or sugar, it creates acid, which leads to decay in your tooth, and that's known as a cavity. So for people that don't brush often, they get a lot of cavities because they're not disturbing the plaque that forms. And the acid also demineralizes the tooth, which is obviously the cavity. Calculus is formed above your gum line and below, so that's why it's so important to come get your teeth cleaned, because you can't remove the calculus by yourself because it's too hard for like a brush to get rid of. And that's why you come get your teeth cleaned, because we use the instruments because they're strong enough to remove the plaque. Especially when you have subgingival calculus, because your brush can't get underneath your gum line enough to remove it. So if you don't remove your calculus and you don't remove your plaque, then it leads to periodontal disease. There's two types of periodontal disease, gingivitis and periodontitis. The difference is that periodontitis, there's bone loss, and gingivitis, there's no bone loss. So with both, your teeth bleed a lot, they're sensitive, and as you can see, with the progression of periodontal disease, in the beginning, with healthy gums, you have like a nice pink, there are no spaces in between your teeth, but as it progresses, the tissue around your teeth, your gums, start to get more inflamed and change color, and then by the time that you have advanced periodontitis, you can see spaces in between the teeth, you can see a lot of stain, and even the root starts to show, and that's all happening because of the bone loss that's happening to your teeth. So your home care is like super important because, like I said earlier, the carbs and the sugars that you intake, that's what causes the acid on your teeth, and then that eventually causes the decay. So it's important to stay away from sticky and sugary foods, especially liquids. So if you're going to have a soda, it's better to just drink it all at once and then kind of like swish out your mouth with some water, rather than drinking soda all throughout the day. Some people get like a huge thing of a big cup of soda and just drink it all day, and it's bad because you're reintroducing the sugar constantly. So you want to make sure to just drink it all at once rather than throughout the day. Another thing with the sticky foods, if you're gonna have Skittles, for instance, that's super sticky and sugary. So rather than eating them throughout the day, snacking on them, it'd be better for you to just eat a bunch and put it away, and then, like I said, rinse out your mouth, or if you have the opportunity to brush your teeth to get rid of it. You can see right here that there are some healthy options and maybe some that kind of surprise you that are good for your teeth, like the cheese. Apples are great. Lots of fruits and vegetables. But then with the bad foods, you can see sweets and sugary drinks like alcohol or soda. So the obvious home care methods that are important are obviously brushing. So you want to brush twice a day. If you have an electronic toothbrush, that's some people prefer that, but it's not necessarily better. But for some people, it might just be easier. We definitely want you to brush in the morning and at night. Definitely at night, because we don't want the plaque that forms throughout the day to just sit there all night, because that just gives it more time to harden and turn into calculus. Another thing that we want you to do regularly is floss. So every time you brush, at least once a day floss. And it's important to seesaw the floss into the embrasure space in between your teeth, not just pop it in, because then you could hurt your gums. So you use the picks, which is okay if you have them. Ideally we would use regular floss, because it's good to use a new fresh piece of floss every time you floss. But if you prefer to use pickers, then these are okay. And then another cleaning agent would be the mouthwash. There is alcohol free. The alcohol definitely does work better to get rid of the bacteria in your mouth, but some people are sensitive to that, especially people with periodontitis. So for those patients, we would use no alcohol, but for us, that's fine to use alcohol. So the brushing method that I would recommend is called the Bass method, and that just gets into the sulcus of the teeth. The sulcus is like underneath the gum line. So what we would be doing is angling the brush into the sulcus, not going straight onto the teeth, but angled up. Do you see what I'm talking about? Mm-hmm. And so that would just be helping us clean underneath the gum line a little bit. It doesn't really go in there much, and also it helps with the interdental spaces. The interproximal areas. But we also want to make sure not to rub the brush against the gums, because that could cause trauma and really get them inflamed. Fluoride is important to have. So at the dentist office, you have the option of getting fluoride. It is a little bit expensive in most dentist offices, so adults don't usually get it, but we do recommend it. It's important for children to get fluoride because it helps create a strong enamel, and it remineralizes the enamel as well. It also helps with sensitivity, and it prevents bacteria growing in the mouth, helps your teeth become strong, so that's why it's important for us to give it to kids. But just having the dentist office isn't the only option. A lot of the times, toothpaste will have fluoride. Like the toothpaste that you use has fluoride. You can see it right on the package. So that's a really good thing. This toothpaste is also really good because it bubbles very nicely, so it also is able to get up in those spaces and really clean out the sulcus. And then some more interdental agents that we have would be the mouthwash again, and then also a tongue cleaner isn't really an interdental agent, but it helps clean out the bacteria in your mouth, where you just hold it like this and you clean off your tongue. It's good to do daily. You don't want to go back too far and hurt the papilla on your tongue, but this helps with bad breath or, just getting rid of the bacteria on your tongue. Another really good thing to have is the electric toothbrush because it helps with that as well. For you personally, I know you don't have periodontal disease or like sensitivity really with your teeth. The main thing is probably plaque and calculus, but just make sure to go get your checkups regularly.
That was good.